Hey, it's Rebecca Smith from the KBIA newsroom in Columbia, and it's time for Missouri Health Talks, a project where we listen in on Missourians' conversations about access to health care. This week we hear from April Mickens Jolly. She's the Vice President of Health Equity and Culture at Planned Parenthood of the St. Louis region and Southwest Missouri, and a Black mom. In Missouri, Black women are 4 times more likely to die within a year of pregnancy than white women. So she spoke about this serious problem and about how the problem goes beyond just getting to a doctor. Here's April.
I don't know that my experience as a Black woman has made me better at my job. I think that it provides a level of empathy. Maybe that I don't know if it's more empathy, but I'm certainly conscious of some of the challenges that our patients certainly are facing. But I think that everyone who works in healthcare especially needs to be really conscious that we don't know everything and that we need to listen. So, I think it's important to point out that the crisis that we see with maternal health and definitely with Black maternal health is driven by systems and policies. And specifically for Black women, it's systemic racism that is at the root of much of what we see. And so, when we talk about poor outcomes in terms of health and people losing their lives or not having the pregnancies that they wished they had that maybe weren't as healthy as we would all hope for, it's driven by more than just people's access to clinical care. It's, housing, whether you're in stable housing, whether it's safe housing, affordable housing, access to transportation. Do you live in a neighborhood or in a county that offers access to affordable and healthy and high quality foods? And so all of the kind of intersections of all of the policies that we set all have an impact on whether people are able to access not just care, but able to live healthy and thriving lives, including the period before they're pregnant, during pregnancy, and then in the postpartum period afterward. I just really want to make it clear that it's preventable, the crisis that we are seeing. We have Black mothers dying 3 to 4 times at 3 to 4 times the rates of white women. And it doesn't have to be like that. There's nothing, that's wrong with Black women that's causing their pregnancies or their health to not be as great as their counterparts who have a different race. And so just want to emphasize that the bottom line is that it's systemic racism and the intersections of oppressive policies that have led to that, and that through intentional policy we can also get to a place where that is not the case.
That was April Mickens Jolly with Planned Parenthood of the St. Louis region and Southwest Missouri, speaking about what communities can do to decrease the risk of pregnancy to Black women. That's it for this week's Missouri Health Talks, which was reported and produced by Rachel Schnelly. Tune in next week for more conversations from throughout the state about health and access. I'm Rebecca Smith. Thanks for listening.